Good afternoon, everyone. We have reached the noon hour, so let's get underway. Thank you so much for joining us for today's bi-weekly media briefing on the local COVID-19 situation. Thank you so much for joining us. Thank you, Mayor Therrien, for joining us today, and Inspector Lyons from Peterborough Police. And also thank you to Andy Mitchell, our board chair and mayor of Selwyn Township. My name is Brittany Cadence. I will be emceeing this as usual today, and look forward to working with our media when they've got some questions as we work through today's presentation. Okay, to start us off, let's take a moment and acknowledge where we are and the history and important contributions of our Indigenous partners. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so now I'd like to invite our Board of Health Chair, Mayor Andy Mitchell, to begin with some opening remarks. Please go ahead, Andy.
Thank you, Brittany. I want to start by noting that this will be Dr. Gemmel's final media briefing before his tenure as Peterborough Public Health's acting MOH comes to an end. I want to publicly thank him for his guidance and support during these last few weeks. The community has been well served by his efforts and attention. At our next briefing, scheduled for December 2nd, Dr. Piggott, our new Medical Officer of Health, will be participating. There are many COVID-19 related initiatives that will be addressed over the next few weeks. The rollout of third doses and booster doses, an immunization program for children 5 to 11, and addressing a moderate but steady increase in cases. Vaccination results in our community have been positive, with almost 85% of all those eligible having been fully vaccinated. To all of you who have stepped up, thank you. This means, however, that a quarter of our entire population remains unvaccinated and continues to provide an opportunity for COVID-19 to spread more widely. The expected authorization of vaccines for a younger cohort will help push up our overall community coverage. Across the province and here locally, we have seen an uptick in new cases. In the 2 weeks ending last Sunday, we recorded 45 new cases. In the 2 weeks prior to that, we recorded only 20 cases. It is important that we remain cautious and follow public health advice. If you are eligible, please get vaccinated. Continue to adhere to mask mandates applicable to many indoor facilities or where physical distancing is not possible. And if you are ill, stay home and get tested. We have come a long way as a community and accomplished a lot together. Please do not allow the accomplishments of the many to be drowned out by the actions of a few. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Andy. Okay, so I'd like to now invite our Director of Public Health Programs and Incident Commander for the COVID Emergency Response, Donna Cherpy, to share the latest data with us. Go ahead, Donna.
Good afternoon, everyone. So I'll start with the situational update and just looking at our tracker from yesterday's count as of 4 p.m. You will note that both our case numbers and high-risk contacts have shown an increase over the past 2 weeks, as mentioned already by Mayor Mitchell. And presently, there are 21 active cases in the community compared to only 12 2 weeks ago and 108 contacts. when last time we met, we were reporting 36. And this is largely due to the cases connected to local elementary schools where majority of students are unvaccinated, so there are larger numbers of high-risk contacts that we need to follow. And this next graph helps to compare the change in weekly case counts to earlier waves in the pandemic. And you can see as we begin this fourth wave that cases are steady and increasing slowly. And on the positive side, though, thanks to good local vaccine uptake, we are not yet seeing an increase in hospitalizations and ICU admissions at PRHC. However, as Mayor Mitchell noted, there is still 25% of our local total population who remain unvaccinated. So on continuing to wear our masks and keeping 2 meters distant from others, washing hands frequently, checking for proof of vaccination in high-risk settings, and enhancing ventilation in all areas possible are important protection measures. And so this slide shows you the age groups of newly reported cases for the 4-week period of October 20th to November 17th. And youth continue to represent a high number of our cases. However, there are numerous cases in other age groups as well. And many of these cases continue to be unvaccinated. However, there's probably or maybe an influence of lifting capacity limits, and that's why we're seeing some of these increases in cases in other age groups. Next slide. So it's good to see that we continue with 0 COVID outbreaks in the community. However, we are starting to see outbreaks in other respiratory viruses in local seniors congregate settings. And that serves as a good reminder for all of us to get our flu shot, which can be co-administered, at least in adults, with the COVID-19 vaccine. So this data was recently shared by the Ontario Science Table, and the bars on the left show all of the health units that are currently experiencing an increase in their weekly case incident rates, or at least over the past 14 days. And the bars on the right, so there's 8 or 9 of them, indicating health units that are experiencing a decrease. And you can see in some of the health units that the increase is quite substantial and steep. And that's why we're seeing some other regions introduce stronger public health measures, because we know it is the combination of all of the public health measures and high vaccination rates that are required to reduce the spread of COVID-19. So this map you're all familiar with shows you the case incident rate per 100,000 reported from November 3rd to the 9th across southern Ontario according to postal code. And in the green text box on the right, you can see that Peterborough's weekly incidence rate and for the period ending November 13th, it did jump quite a bit to 16.2 cases per 100,000, which is up from 6.8 cases per 100,000 2 weeks ago. And the provincial rate also has increased and now stands at 26.7 cases per 100,000, and that's up from 16.9 cases per 100,000 over the same period. So when we look at the map, you can see how this fourth wave is playing out somewhat differently in that some former hotspots, like in the GTA, are not seeing these increases in cases, while the majority of health units are experiencing increases, even in areas like Kingston, which escaped major case surges during previous waves. And this just reflects how unpredictable the virus is and why it is so important to continue to limit travel as much as possible throughout the province. This graph shows the recent data from our wastewater surveillance. And as noted last time, Lakefield's wastewater system is now included. The green bar shows Lakefield data, and the blue represents Millbrook, and the red shows Peterborough's data. And we can see that there are signals being detected, and quite substantial signals in the Peterborough system, but no signals over the past few days in either Millbrook or Lakefield. And we will continue to monitor this closely. And here's our current vaccination data as of the end of the day yesterday. And we're pleased to introduce that we're now able to report local uptake of third doses as well. And this includes third doses for the purposes of those who are immunosuppressed and part of their primary series, but also the booster doses. So those new booster doses for 70 plus healthcare workers, First Nation, Inuit Métis, and those who had 2 doses of AstraZeneca. So you can see in the orange graph to the right that just over 9% of adults over the age of 70 have received a third dose, and that when we look at the entire adult population of those 18 and over, 3% have received their third dose. And just a reminder that we have lots of appointments available at this time. So anyone who is eligible is strongly encouraged to book their booster. And that's especially a strong recommendation for those who are over the age of 80. And if we look at our youth rates on the left, you can see that now well over 82% of those between 12 and 17 have received both doses. And this is a 2% increase from 2 weeks ago. The middle chart shows the proportion of eligible residents, that is those who are 12 and over, who have received the vaccine. And these rates have increased marginally as well over the past 2 weeks, and now almost 85% have received both their first and second doses. The pace is slowing somewhat, as this represents a 0.9% increase in second doses over the past 2 weeks, but I can affirm that that there are people who are arriving at clinic still for their first and second dose. And I'd just like to share this next slide with you from the ministry that shows how effective the vaccine continues to be. These graphs show the various outcomes by vaccination status and age band in Ontario, with green representing fully vaccinated people, yellow is for partially vaccinated, and red is unvaccinated. And in terms of the rates of hospitalization, ICU admission, and death, we can clearly see how the unvaccinated represent the largest proportion of these outcomes. So we continue to run the walk-in clinics for first and second doses and appointments only for booster doses 5 days a week at the Healthy Planet Arena. What's not listed here yet is an upcoming walk-in clinic on November 3rd in Warsaw. So that's for first and second doses. And just encourage everyone to continue to visit our website for regular updates on upcoming clinics throughout the city and county, and to remember that many of our local pharmacies also offer the vaccine as well. Thank you.
Okay, great. Thank you so much, Donna. And now we have Dr. Gemmell with us to share a few remarks, and I will just spotlight you so everyone can see. So please go ahead, Dr. Gemmell.
Thanks very much, Brittany, and thank you, Donna, for that really helpful update of what's going on locally with coronavirus. I also want to thank our chair, Andy Mitchell, for his kind words, and just to say how much I have enjoyed working with him, with the board, and with all the team at Peterborough Public Health over the last couple of months. I have 2 or 3 things I want to go over with you today, and I hope that they're helpful to you, and thank you to all the media for helping us to get our information out. The first is the letter of instruction that we have written regarding sports venues that will be taking effect very shortly for the youngsters, 12 to 18, who are going to be engaged as participants in sports and other physical activities. As you can see in the data, the cases are indeed rising locally, as they are in other parts of Ontario. And it is causing, as you've heard, some local public health agencies to strengthen measures to protect their communities. And we will, of course, be keeping this under consideration depending upon how our incidence goes. But here in Peterborough, right now, we're doing the same with regard to protecting our youth who play sports and are involved in other fitness activities by requiring all sports and recreational facilities to confirm proof of immunization for everyone 12 years of age and older. And this requirement does go beyond the provincial requirement that states that the age is 18 and over. We are extending it to ensure that those young people who are engaging in sports where there may be much more likelihood of transmission, aerosolization, and so on, where they may be playing. I did issue a letter of instruction to the sports venues in October, and it takes effect in a few days' time on the 26th of November. There are many reasons why, in collaboration with my colleagues at Peterborough Public Health, but I felt that it was important to issue this letter of instruction. And one of the main reasons, of course, is the Delta variant, which now is a predominant strain in Ontario, and which, as you know, spreads more easily and may cause more severe illness, especially in the most vulnerable population. So it's a measure to protect everybody that we can, and especially our youth. As you saw in the slides today, 82% of youth are already fully vaccinated. So most of them already will be compliant when this letter of instruction takes place or takes effect on the 26th of November. Several other local public health agencies across Ontario have implemented the same measure, and some of the big ones. I think perhaps even over half of Ontario's population now has these instructions in place. So having this requirement in Peterborough as well adds consistency to those who are involved in sports leagues that may involve travel between these jurisdictions. So we've produced a full rationale document on our website that explains why all the reasons and all of the logic behind this. And I would encourage anyone who is keen to understand the justifications that supported these decisions to read that at your convenience. We continue to review the local data closely, and we are prepared to take further measures, as I've already mentioned, to prevent the spread of coronavirus in our community should they be required, and that will be under close scrutiny all through this winter season. So I'd like to just turn my comments now to the vaccination of youth, and we are getting increasingly excited to hear the rumblings that the vaccine for children aged 5 to 11 may soon be licensed in Canada. And of course, once the vaccine becomes available, it will be a game changer in protecting another key population segment in our community. There are approximately 9,000 children who will become eligible for immunization in the coming weeks as soon as the license for the vaccine has been granted by Health Canada. And I know that the province of Ontario is going to do their utmost to get the vaccine into the hands of us immunizers as quickly as they possibly can. I'm extremely proud of the team at Peterborough Public Health for their incredible work in planning these clinics. It has been over the months a monumental task, and this is just the next phase of it. Excuse me. I can say confidently that we will be ready to go as soon as the vaccine arrives in our community, which will likely be a week after Health Canada gives its authorization. The vaccine will need to be shipped to Ontario and then will be made available to us by the Ontario Government Pharmacy, and then we will be ready to go. As with any new vaccine, parents and caregivers will need to consider the risks of this disease, of coronavirus, and the benefits of getting their children vaccinated. Peterborough Public Health has prepared a lot of good, credible information to help families make their choice, an informed choice for them and for their children. And the team at Peterborough Public Health is also planning several live virtual education sessions with the incoming Medical Officer of Health, Dr. Thomas Pigott, when he begins his work in the next couple of weeks. Details will be available on our website. In addition, parents can consult with their physician or with a pediatric nurse to discuss their personal health choices. These services are offered by our healthcare partners at the Scarborough Health Network and at Toronto Sick Kids Hospital. And to find out how to book a phone consultation, just visit our website. And Brittany, I just wonder if you can put that, rather than reading it all out, if you can just stick that in the chat box for our guests from the media. It's been really exciting to see all the great ideas that staff have come up with to make our immunization clinics for youth, child, and family friendly. So the experience has been a very positive one. Parents can expect to receive details about the local clinics and all the resources that I mentioned through the schools, and we will be promoting these clinics widely on our website and through local advertising. So please stay tuned to our website and to the social media accounts for these announcements once we get notice that the vaccine has been licensed and the green light to proceed. And then the last thing I'd like to talk to you about today is the boosters and third doses. And you've heard a little bit about the coverage with the third doses while we wait to launch the immunization program for the 5 to 11s. In the meantime, we are strongly encouraging booster doses and third doses for all those who are eligible. And as you saw from Donna's presentation, so far only 9% of local adults over 70 years of age have taken advantage of the booster shots. Now, people will become eligible over time because the minimum time period between the second and third doses is 168 days. That's been determined by the Ministry of Health. In other words, 26 weeks or half a year. So there will be more people eligible with every day that passes, but we really are encouraging those over 70 to get this done as soon as they become eligible, because we're going to be very involved in immunizing the kids as soon as that is possible. We know that as we age, our immune systems don't produce as many antibodies as when we were younger. So please, if you're over the age of 70, and especially over the age of 80, where the risk of complications of coronavirus is much higher, get a booster dose, a free booster dose, that extra layer of protection. There's lots of good evidence that this extra dose, when given 26 weeks or 168 days after the second dose, will increase the personal protection and will keep our vulnerable citizens and our community safer. In closing, I would just like to thank all of you for this opportunity to serve as your interim medical officer of health and to be part of this high caliber team at Peterborough Public Health. It's been a privilege to experience firsthand how well this community comes together for the greater good, something that Peterborough is well known. And I think it's evidenced by the increased vaccination numbers that we've seen and the commitment to providing service of high and impeccable quality to Peterborough Public Health and all of its partners. And just as a final thank you to everybody in the media who does such a good job of helping us to get our message out. Without you, it would be significantly more difficult. And you're terrific partners in helping to keep our citizenry informed of all the rapid and quickly changing developments that are occurring in our communities. Thanks, and back over to you, Brittany.
That's wonderful. Thank you so much, Dr. Gemmell. And yes, sincere thanks to our media partners who make this happen. And it's just been wonderful working with you, Dr. Gemmell. Thank you for everything. Before we move on, I'll just see if our Mayor, Diane Tarian, who's on the line, if she had any comments or just want to be available for questions if there are any. Mayor
Thanks,
Tarian?
Brittany. Yeah, I'll be available for questions and just want to echo all the thanks to Dr. Gemmell for all the work that he's done. It's been a pleasure. Other than that, I'll just be on the line. Thank you.
Okay, great. Thanks so much. So let's hear from our media partners, and I will just note that we are fortunate to have Inspector John Lyons from Peterborough Police here with us as well if there are enforcement related questions. So let's start then today with Paul Rellinger from Kawartha Now. If you've got some questions, please go right ahead.
Thanks so much, Brittany. For Dr. Gemmell, I did have a question, and if Julie Ingram is on the call today as well, I'll have a question for her.
Julie's not on the call, but enforcement questions can likely be answered by Donna if there's anything in that regard.
Okay, that's great. Thank you. Dr. Gemmell, we've seen some regions across the province, and you alluded to this, pulling back on kind of what's allowed as their case counts and their numbers have gone up. I'm just trying to get a sense of, even though our numbers have gone up a little bit over the last couple of weeks, what's the threshold here? We haven't seen that yet. It's to the extent that we're seeing it elsewhere. What sort of things would you have to see before that would even be considered? Obviously, a current trend with numbers going up, I take it, would be disturbing.
Yes, thanks, Paul. And you're right. This is a question of close monitoring and good judgment. And I think that what we've seen so far is some significant percentage increases, but still relatively low numbers. When it's at this level of a dozen or a couple of dozen cases, it can bounce around an awful lot. So I think that the issue here is that we will remain vigilant in terms of our case count, checking this every single day. And I think if we start seeing increases that make us think that we've got what we call undocumented transmission in the community, we would have to look at various measures extra measures to keep our community safer. And what I mean by this undocumented transmission is that, if I've got, for example, a kid who, through, say, playing a sport, we use that as an example, is exposed to coronavirus and gets it, we know that his family, then they become high-risk contacts, then we know that if they become cases, we know where that came from. When we start getting cases where we cannot find a source, or if we get enough of these, it makes us worry that we now have this undocumented transmission where this has been happening because of unknown exposure in the community. So I think that's going to be the number one trigger for us to look at what additionally needs to be done. And of course, we have a minimum standard now where people are still being asked to wear their masks in public places, to wash hands and so on. But as you are aware, there are, in Sudbury, I think, for example, there have been some additional measures put in place to put restrictions on some of the more discretionary venues that people may go to. And none of this is out of the question anywhere in Ontario, including Peterborough. Thanks for the question, Paul.
Thank you. And if I could, Dr. Gemmell, just wanted to clarify for the clinic at the Healthy Planet Arena, for booster shots, you do have to book ahead, correct? There's no walk-ins there?
I'm going to defer to Donna because she's our expert on that, but I think you're right. But Donna, can you answer Paul's question on that one?
Yes, I can confirm for booster doses, you do need to book an appointment through the provincial booking system. We do still accept walk-ins for first and second doses and third doses. So if somebody has a referral from a physician or proof that they are immunosuppressed, we would provide the third dose. But for the booster doses, for those 4 groups that I mentioned previous, they do require an appointment at this point in time.
Thank you, Donna. Would that be the same for the upcoming immunization of kids 5 to 11 as well? Would that be phone in as well?
It would be, you would have to either call the provincial booking system or you can go online to book an appointment. And yes, we will have appointments only for the 5 to 11-year-old. And as you can imagine, for a number of reasons, to try to minimize lineups, and especially as we're getting into colder weather, it just provides a much better experience for families.
Thanks for clarifying that. I thought that was the case, but you never assume, right? The only other question I had was regarding enforcement. I was going to ask Julie, but maybe you could help with that. Anything new there that you can report? Anything that we should be aware of? I know a cease and desist order was issued earlier regarding one business, but what are you seeing out there now?
We're still, there are still some investigations ongoing, and we're still pursuing, other appropriate legal action for associated with those investigations. And so unfortunately, not full compliance yet.
Okay, but not to the point where there's been any new fines since last time we met?
Not since the last time, no.
Okay, great. Thanks so much, Donna. I appreciate it very much. And thank you, Brittany. That's it for me.
Great. Thank you so much, Paul. And I'll just remind all of our guests on the line, we do have a webpage. I'll put the link up in a moment where we do disclose any fines or other measures that are taken with regard to non-compliance to the Reopening of Ontario Act. So that's on our website. Okay, thank you, Paul. So let's hear from Bill Hodgsons from Peterborough this week, if you've got some questions for our speakers. Go ahead, Bill.
Actually, I had a question about the 5 and older, but Paul just covered it, so I'm good. Thanks.
Okay, all right, good stuff. Then let's move on to Matt Latour from Oldies and Freak Radio. How are you doing today, Matt?
I'm not too bad. My question today is for Dr. Gamel. First off, thank you for the last couple of months as the acting medical officer. My question had to do with, I guess, your departure. How much will you be working with the new medical officer to make sure that kind of he gets his wheels rolling quickly once he's in town?
Well, thanks, Matt, for the question. I'm sure that my colleagues at Peterborough Public Health have got a full orientation available for Dr. Piggott. Also, you should know he's an experienced medical officer of health. He's coming to us from Labrador, which is an area that is large and has lots of, I should say, health conditions that need to be addressed and so on. So you're getting a smart guy coming, and I don't think I'll be teaching him too much about how to do public health. He knows all that sort of thing. But as always, I'll do a debriefing with him to tell him what kind of situations we've been dealing with lately, and also would of course be available to answer any questions that he would have on things that have been transpiring over the last few weeks while I've been here. He also, don't forget, has got a cadre of 33 other medical officers of health and their associates across Ontario to call upon as well. So we'll keep him well informed about what's going on in the Ontario system. Thank you, Matt.
Perfect. And my last question is also for you. I mean, now that you're almost done as the acting medical officer of health here, what's next for you? Do you have something else lined up?
Well, Matt, I am retired, and I'm doing these stints with my colleagues in various places just to help out. So I'm an acting medical officer of health in Belleville, in Port Hope, now in Peterborough. It's been great to see all the colleagues in the East that I'm really getting to know now, and that's been a lot of fun for me. I plan to do some of the things on my list of 15 things that I wanted to do when I retired, and to spend some time with grandchildren. And if there are other opportunities that to help out that people approach me about, then I certainly will consider them as well. So, but thanks for asking the question. I'm glad to have a bit of a break again, but I've also been extremely glad and thank Peterborough Public Health for the opportunity of still being able to be involved in the most dramatic and historic part of public health in living memory, this pandemic. It's been very interesting and, of course, professionally, extremely rewarding for me. Thanks a lot, Matt.
Perfect, Dr. Mel. Thank you. That's all I had.
Okay, great. Thank you. Thank you both very much. Okay, I think we have Jessica Nisnik joining us from Global TV Peterborough. So if you've got some questions, please go right ahead, Jessica.
I do. Thank you, Brittany. Dr. Gemmell, hello, and thank you for taking our questions today. Can you tell me what the difference is between a booster and a third dose? I believe it's the same thing, and I'm wondering why we're using it interchangeably, because it's confusing people as far as I know.
You're right. I mean, it is a subtle nuance, and I think that if I can help to explain it, I hope it'll remove some of the confusion that exists, Jessica. When we give people a new vaccine, we give them what we call a primary series. The primary series will comprise 1, 2, or sometimes more doses of vaccine to get baseline protection. For most people with coronaviruses, the primary series comprises 2 doses, as we all know. There is one vaccine, the Janssen vaccine, that is licensed for 1 dose, but I suspect actually people are probably going to need another dose of that one to get a good, really good protection. There's a small group of people who may not have as robust an immune response who need more than 2 doses to get that to that baseline, and that's called the 3rd dose. So it may be people who have got immunocompromising conditions, people with chronic medical conditions that just make their immune systems not as able to mount the response that they need to get that baseline protection. So it applies, the 3rd dose applies to a small number of people, and by small, I should say a small percentage. The number is not small. It's actually thousands and thousands of people with chronic conditions, but the percentage of the population is small, who need that 3rd dose to get their baseline to complete their primary series. So that's what we mean when we say the 3rd dose. What the rest of us are getting is the baseline protection. And then because we know that coronavirus is naturally, and probably with this vaccine as well, will have protection that slowly will deteriorate over time, not fast, but we're worried that we may not have as full protection. They need an additional dose to just send that antibody level skyrocketing again so that they can be fully protected. So you're absolutely right. It's a nuance. When you think of 3rd dose, think of people who don't amount a great immune response, and so it's people with these chronic medical conditions. With everybody else, think booster, that they've had their baseline, and just to arrest that waning and to give them a jet propulsion of antibodies so that they are even better protected. That's the booster dose. I hope that clarifies. And again, I agree with you. It's a wee bit of a subtle nuance for those who are not in the medical field.
Right. So basically is it the dosage the same as the other 2?
There is a subtle difference here, and it depends upon the vaccine. And correct me if I'm wrong, Donna, but I believe with the Moderna vaccine, it's a full dose for the people who are like 3rd dose, but only a half dose for people who are young and healthy. And just remind me, is it a full dose for people over 70 as well? I believe so. Did I get that right, Donna?
Yes, it's a full dose so the Moderna vaccine is a full dose for those over 70, but half a dose for those under 70 who are getting their booster doses.
So
the rest of it's the same.
It gets a little complicated, as you can see. And for Pfizer vaccine, there's no change.
Okay. So this might be a question you can't answer, but Dr. Gemmell, but how does the medical community know that it's not the vaccine is not mounting the immunity that it needs? Is it because these people who have had 2 doses are now getting sick? I just wonder sometimes how we figure things out.
Well, after a vaccine has been licensed, that there's what we call post-marketing surveillance of both the disease and of the antibody protection. So it's a way of monitoring how well our vaccines are working. And both of these factors are taken into account when not just I or even people in the province of Ontario, but across the globe, when they're looking at how these vaccines are working. It's noticed that perhaps there is more breakthrough cases in people with certain conditions, which is why it's now believed that a 3rd dose is required to give that baseline protection. Or, as happens as well, I can't quote you any studies as yet, but they are looking at how the antibodies persist or decline over time. And of course, for people who require more than 2 doses to get that baseline protection, that is going to be a bit more of a precipitous decline. So this is a way of keeping people whose immune systems maybe are struggling a bit to have that additional baseline dose to ensure that they are fully protected against this infection. Those are the 2 ways that they do it, Jessica.
Thank you. And Dr. Gemmell, I have a few more questions, and it's related to the childhood vaccine. I believe that the kids under 12 will be getting a third of the dose. Is that correct?
Yes, there's a special preparation, and it's going to be Pfizer vaccine that's provided currently, because that's the one that's now being reviewed by Health Canada. I understand from news reports that Moderna is also having their vaccine assessed by Health Canada for this age group, or I should say older age groups, excuse me, younger age groups, but I haven't seen the details on the dosage for that one. So the one that, the vaccine that will be provided by Pfizer and approved by Health Canada is 1/3 of the dosage that a person over the age of 12 would get. And it's been shown through the clinical trials that Health Canada is now reviewing that the protection afforded by this dosage in the kids gives good protection.
Do we know at this point then whether the under 12s will need a second dose?
My understanding is that for the Pfizer vaccine, the two-dose series is going to be standard, depending upon whether one is getting the pediatric formulation or the adult formulation. It will still be comprise a two-dose schedule for kids. Whether there would be a third dose for kids who have got significant say immune diseases and so on remains to be seen. We'll need to sort that out as we get more information about this. As you can see, it's a bit of a moving target. We're actually giving the vaccines, and then as we go along with greater and greater numbers who are immunized, assessing what the effect is and how well the protection works in vulnerable groups like the kids who maybe have chronic diseases or immunocompromised. So stay tuned on the third dose for that group, but the two-dose series will be the norm.
Okay, and you mentioned, Dr. Gemmell, a little bit about, there's preparations. I know we've talked about this before, behind the scenes happening for the vaccine rollout for kids, and you're working with local school boards.
Right.
Can you tell us anything about what you know to date about how this will roll out? Is it going to be at schools? Is it going to be a clinic? Do you know?
It's going to be multifaceted, as I understand it, but I'm going to again ask Donna if she can answer your question, Jessica, because she's right there leading the charge on the planning for this. So if I can ask Donna to respond, I think you'll get a better answer than me.
Sure, we're happy to provide a response. So we are planning clinics at both the Healthy Planet Arena and in county schools to start with. So the Healthy Planet Arena will have a evening clinics, which will be hosted by primary care. And we are hoping to have some Saturday clinics in collaboration with primary care, but and potentially a few daytime clinics at the Healthy Planet Arena for the 5 to 11s. And then the school-based clinics will be after school or later in the day kind of school so that parents can attend those clinics with their children. So they will be about the same time interval, the 5-minute appointment, but these clinics will also have the opportunity for children or for parents to ask questions, to consult potentially with a physician or even a pediatrician to ensure that they are able to provide informed consent. So still working out some of the logistics, but those are the main components. And once we have determined the response to the vaccine, and we can assess where there are maybe some pockets of children who have not been able to gain access to the vaccine, we will plan clinics accordingly. So we may go to some of the city schools or offer other pop-up types of clinics similar to what we did in the late summer, early fall for adult populations who had difficulty gaining access to the vaccine.
Thanks, Donna. And just one more question for you then. Do we know how quickly we can get this going once we get the approval?
So as Dr. Gemmell mentioned, we imagine or we understand that it'll be at least a week from the approval to the receipt of the vaccine in Canada. And then distribution will need to happen from the warehouse in I think it's in the Mississauga region. So 7, 8, 9 days maybe that we would be able to start rolling out. And then we will have appointments available pretty close after that. So we're still waiting for a final date, but it's anticipating about a week to 10 days after the approval that we should have appointments available for parents.
Great, thank you. And I know I've taken up a lot of time. I think that's good for you, Donna. I think this question will be for Dr. Gemmell. Thank you so much. And this is my last question. I've heard of a lot of parents who have received their doses willingly, but are very skeptical about getting their kids vaccinated, especially when there's a third of the dose for 11-year-olds, but then you've got a full dose for 12-year-olds. That's causing a lot of concern for parents. What would you say to parents who might be hesitant? I know you've got these information sessions. I think that's great. But do you have any words for parents who are a bit frightened?
Well, first of all, I think parents shouldn't be frightened of the vaccine. What we should be frightened of is our children being ill with coronavirus, because while kids on average don't have quite a severe disease, there are kids who have suffered from this infection. And the vaccine is our safest and longest lasting and most effective way of ensuring that our kids don't get this. And we got kids in school now. It's a way of keeping our kids safe. It's a way of keeping the schools as safe as possible. And it's a way of adding coverage to our population so that this virus will have more trouble circulating, and therefore maybe this pandemic will subside. The dosage schedule for coronavirus, while you're right, there seems to be this, the day you turn 12, all of a sudden you're eligible for a higher dose. This is no different, actually, Jessica, than any other vaccine we've got. And I guess the way to look at this is to say that we know that the 1/3 dose works well for the younger kids. It's kind of impossible to have a gradation based on age that has tiny little variations in the amount of dose. So we stuck with 2 doses here. But if I can say this, and that is that having extra is not necessarily going to make the vaccine response more robust, but it's not going to cause any problems. It's been tested. We know that kids who are age 12 can receive a vaccine at the full adult dose safely. And the pediatric dose has been adjusted, I think, just to say, well, we know that for younger kids, we don't need quite as much to get the same immune response. Giving more isn't harmful. Say if a kid is now 11 and turns 12 or whatever, it just is probably unnecessary, but you've got to draw the line somewhere. So this is something that I think is just really kind of, it's a way of making it as simple as possible and not as and less confusing for people to have this. And it's the same as we do for, you name a vaccine that kids get, say, for tetanus or diphtheria, that when the kids, the adult doses are smaller. And that's just the opposite. The kids need more when they're younger. So I think the bottom line is that both the safety and the effectiveness of these vaccines, and generally, and a coronavirus vaccine specifically, have been tested in the clinical trials. They will not get, they would not, I shouldn't say will, they would not get approval if there was any problem with the safety or effectiveness. And so we have good data to support the safe use of these vaccines in our kids. Way safer, way like orders of magnitude, light years safer than taking a chance with the virus. Hope that answers your question, Jessica.
It certainly does. And thank you for all your time. I know I asked a lot of questions today. So thank you very much, everyone, for your time.
Great, thank you very much, Jessica. Lots of good information that you always allow us to share. And thank you, Dr. Gemmell. And again, on behalf of all the staff here, Dr. Gemmell, we really appreciate your service over these last 2.5 months, and really appreciate the admirable job you've done to keep our community informed through these scrums and other ways. So wonderful to work with you, and wishing you all the best. So thank you.
You too, Brittany. It's been a pleasure.
Okay. Okay, well, I think that brings our session to a close. Thank you all for joining us, and we will see you back here on December 2nd, and it will be the inaugural media briefing with Dr. Piggott. So looking forward to having you back then, and thank you all. Stay safe out there.
Thank you, Brittany.
Thank you. Have a good day.
Bye, everybody.
Have a good day.